Robbie, welcome to the office.
Thank you.
You come down by the Seattle?
Arlington, yeah. I'm about 30 minutes north of Seattle, Arlington, Washington.
Okay. So tell me a little bit about your story.
Well, I mean, I've had all kinds of different symptoms for a long time, but probably about 20 years, I'd say.
Okay.
Probably less than a year ago, I was having some really intense vertigo and some ear ringing. I was on a job site, and I was like, I just don't know what's going on. And I, of course, right away, boom, tumor. Got a tumor. So I started, I was stupid, started Googling things. But
Oh boy.
and I was like, okay, all roads lead to cancer. But so I kind of just started to calm myself down, ignore it, started seeing a lot of doctors. Nobody knew what was going on. And then my wife said, hey, you're clenching at night. Maybe that's what's causing your ringing in your ears. So I had an NTI that the dentist had prescribed. He said I was clenching and grinding and all that. Here's an NTI where that. I didn't really like it. I didn't like how it was in my mouth, and I didn't like how it made my teeth feel the next morning.
Sure.
But I was like, okay, I'm going to start wearing this thing religiously, every night. So I did that for like 2 or 3 nights, and that's when the jaw pain really started. And it's like my jaw shifted forward, and I was like, oh man, what is going on? But I think that actually exposed what was actually going on, because that's what started making me think.
What, wearing the NCI?
Yeah.
Yeah.
I started thinking maybe there's something going on with my jaw and my jaw joints, and then I started doing some research, and I learned about TMJD and really started to do my research on that.
Sure. So, have you ever been diagnosed with anything like Meniere's disease, trigeminal neuralgia, TMJ?
Nothing.
No.
And I went to an ENT, and I mentioned to him about my jaw pain and my ear ringing, and he, like a deer in headlights, he didn't know. And this is an ENT, and he's a really good doctor, but and now I'm on allergy shots, but he had no answers for me whatsoever. He actually did a scan of my sinuses and said everything looks clear. So,
Okay.
and I'm like, what's going on? And well, it's just hearing loss. And I said, this literally happened over a period of a day or two. Like someone just kicked down the door, walked into the room, and turned the decibels up. Let's get this party started. Boom, the ear ringing just was intense. I was pretty worried, like what's going on, and the more research I did, and then the jaw pain started, and the joint pain started, and all the symptoms. And when I started looking at the symptoms and started doing the research, all roads led to TMJD.
Yeah. So tell me about vertigo. Do you ever get the vertigo so bad that you have to sit down, or?
Not really. I mean, I've had to kind of brace myself, but I've never really sat down. I've never really let it scare me so much. It just, what's going on? I just feel that ear fullness, and
Sure.
and when it really starts to get sore here, and the ear ringing starts, my neck pain starts. It's like all connected. It's just this intense, and the vertigo really starts to ramp up.
Okay. Well, I ask because there are things called drop attacks where the room is spinning so violently that they can't walk. And so they'll get nauseated, and they'll kind of just like lay down. And that's why they're called drop attacks.
Yeah.
Because you're basically laying on the floor of the bathroom until you throw up, or
No, I'm not like
passes. Not that bad. Okay, good.
No, just kind of brace my but there has been some times where it was really intense. Like I'm sitting there, I'm like, whoa, and it coincides with the jaw pain, the neck tension, the ear ringing. When that's really ramped up, I noticed the vertigo's at it, really bad.
Okay. I asked you what were the main symptoms that you would want to hope to take care of, because you've got quite a few symptoms on here, and I would imagine some symptoms are greater than and others are lesser.
Mm-hmm.
But you did mention the vertigo, the tinnitus, the ringing in the ears, and then headaches, facial pain.
Right behind the eyes, it starts to get tight up in my temples, and I can feel it. It's also like right under my cheekbone, all here. It's like, and then kind of goes up to here, and the next thing you know, it's just hurting up here. I mean, it hurts so bad sometimes. I'm trying to sleep and closing my eyes, opening my eyes. It doesn't matter what I do until I start popping pills.
Well, what do you take for pain?
Lots of ibuprofen.
Okay.
I try not to as much as I can. I'll try to deal with the pain sometimes, but, and of course I notice I drink a lot more when I'm going out, and I'm like, well, if I want to have fun, I'm, just to kind of cope with it.
How do you sleep?
It depends. I'll go through 2 or 3 nights where I'm not sleeping very good. And then the 4th night or the 3rd night sometimes I'm just so exhausted.
Do you feel like symptoms are ramping up during the day if you didn't have good sleep the night prior?
Yeah.
Okay.
Yeah, I notice when I'm not getting sleep, it's pretty bad.
Do you avoid eating certain types of foods, stuff that is chewier, tougher?
I don't eat Skittles like I used to. Once in a while I'll just, I'm having a steak, damn it, I don't care.
Power through it.
Yeah, I'll power through it, but I'll try to go to the softer foods.
Okay.
I've noticed lately. Try to avoid apples a little bit more, but I love apples. I used to eat an apple every day, but not anymore.
Okay. Do you have any questions, concerns, comments?
Not concerned. I've got no questions.
How long have you been searching for an answer for this? Because you said it's been kind of ramping up slowly over 20
I've
years.
been going to chiropractors for a while, and I've always had neck pain, shoulder pain. Never thought that it could be coming from my jaw, my teeth touching. Always, but it's kind of funny how when my jaw really starts to ramp up, so does my neck pain, and everything's just tight. I wake up sometimes, I'm like this, like I'm bracing myself for something all the time. I catch myself doing this all the time, so I don't know. My shoulders are always up.
Okay. You move your head to the right or the left.
Pretty. I mean, I can feel my neck working, and and also tremors. I've had tremors, but I can feel it's like my muscles in my head and everywhere. Like when I'm laying in bed, they're just shaking. Like they've just had a hell of a workout.
Your face is twitching.
Really?
Yeah. I noticed that earlier.
Really?
Just right up in here.
Oh yeah.
A little bit.
Yeah, and that's right about where the muscles, right up under here.
Yeah.
And then it's like it spreads up to here and goes behind the eyes.
Okay, so what we're going to do today is we're going to use T-scan and the EMGs to kind of measure what's going on in real time. Mm-hmm. And we're going to make computer-guided adjustments to your bite, because I already know that your bite force is off, your timing is off too. Mm-hmm. And so, I think critics of this procedure will say, well, it's irreversible treatment. Yeah, it is. 2 things about that statement. 1, everything we do in dentistry, other than clean your teeth, is irreversible. Mm-hmm. 2, if it works, you want it to be irreversible. Mm-hmm. Otherwise, let's say most doctors will treat with a splint or an orthotic or a night guard of some sort, like an NTI, right? Mm-hmm. If you lose that, or it breaks, or the dog gets a hold of it, or you lose it at a campsite or whatever, you start over. Mm-hmm. And those therapies are all based on patient compliance, and the reality is, you're no different than me. If I start feeling better, I don't use the orthotic, right? Mm-hmm. I decided to have this procedure done and kind of put my money where my mouth is as mm-hmm. far as the efficacy. Mm-hmm. So you will be therapeutic 24/7, mm-hmm. and we don't ever have to worry about compliance. The other thing that I really like about this procedure that we're about to do is that it is the only occlusal procedure or TMD procedure that actually improves human mastication. That's been made abundantly clear. Nowhere else in the literature do we see that. So I made, hundreds of orthotics, neuromuscular orthotics for patients. The problem is when you take that out to eat, you go back to your habitual bite, mm-hmm. and the pendulum starts swinging the other way. I mean, it happens instantaneous.
Yeah.
Right? And then you may last 2 or 3 days where you cannot wear the therapy, the orthotic, or the night guard, and then all of a sudden symptoms start ramping up on you. Right?
Yeah.
But if you have a bad day, or the orthotic is, making symptoms peak a little bit because of travel or stress or sinuses or allergies, you can take it out. DTR, there's none of that. You're on the train until it's done. So it tends to, because of compliance is 100%, we tend to see things move a lot faster. At least that's been my observations, and I've done both for years. So if you don't have any other questions, we're going to get started and we're going to take some measurements.
Okay.
Generally, patients report that they notice improvements kind of slow and steadily over time. So you're noticing things that feel weird.
Yeah. It's kind of weird.
It's because what you're used to was so off, but that's what you were used to.
Yeah.
Now it's changed, and so
I feel like my shoulders are heavy a little bit.
yeah,
Just a little bit. Like they're like pulling down a little bit. So
that's relaxation.
Oh yeah. Oh my gosh, that's weird. That's good. That's good.
Robbie, you're back with us. Just we've been kind of at this for about 6 months, seeing you once a month and giving you time to heal in between the revisions and just fine tuning what we did originally in August. And we're in January. And so, Happy New Year, by the way.
Yes, thank you.
And so I just wanted to go over like what has been your experience over the past 6 months, and then kind of like where are you now versus where you started.
And I could function again. So yeah, like I was saying, I could function again. The tinnitus is a lot quieter.
Okay.
Pain in my jaw, I can actually eat. I don't really think about it as much as I used to. It does flare up from time to time, but it's very isolated, like I was saying, and maybe a little temporalis just kind of radiates up into here behind the eyes, but it goes away almost as fast as it comes on. So
Same intensity as you had before, or less?
way less.
Okay. So it's there enough that you notice it, but it's not changing your daily living activities.
Not anymore.
Is
no.
that fair?
Yeah. I
Okay.
used to just sit there and just like, oh, let's go out and do this. I'm not going anywhere. I'm in pain. I can't function today.
Okay.
You can't even think. All you're doing is just sitting there feeling sorry for yourself. That's over.
Right. Well, good. Good for
Yeah.
you. Taking any medications?
Not like I was. Nope.
Okay.
I was eating bottles of ibuprofen and not anymore.
All right. So, you want to know where you're at versus compared to where you were?
Yeah.
Okay. This is what you came in with. This is you in the last 2 weeks.
Wow. Yeah, it was pretty bad.
Thank God we don't have a memory for pain.
It was it was something I'll never forget. But I mean, looking at this, that was me. This is much better.
Yeah. So if you had to, I don't ever show the symptoms on these videos, but if you had to gauge a number as far as a percentage, like, do you think you're 50% better, 70% better?
Well over 80.
Well Well over.
Well over 80. I mean, yeah, I mean, it's more of an aggravation now than anything else. Like, oh, great. I'll be talking to my wife on the phone. I was, yesterday, and I was just driving, and of course I was driving for a while and all that to get here, and I'm like, and she's like, what? She's like, my jaw's tight, just a little tight today. She's like, oh, okay. Before it used to be like, oh God, my jaw is, I can't even, or I couldn't even talk to her. My jaw's just a little tight today.
Okay.
Big difference,
So the intensity, duration, and frequency.
Way down.
Way down. Okay.
Way down, yeah.
Okay, perfect.
Yeah.
Well, and it might be that you just need more time.
Yeah.
Because I know when I had this same procedure done,
Mm-hmm.
I was feeling changes up to 18 months
Yeah.
after my last revision. And so that kind of slow, steady improvement is exactly what we want.
Yeah.
Glad you did it.
Oh, yeah. Worth every damn penny.
All right, excellent.